Thank y'all very much for having me here. I really appreciate it. And I'm looking forward to sharing with you. We're going to go over a lot of great things. I've got a lot to cover, but we're going to make sure that we dive into it, and we dig into it, and we make sure that we've got real actionable items that we can take with us. Okay. We're going to obviously be talking about the opioid epidemic with what's going on. But I want to tell you a little bit about me first, just so you kind of get to know a little bit about us and everything. So we do a lot of work with a lot of different people. So I've worked with the St. Louis Rams. So prior to them leaving St. Louis, we worked with the Rams organization and got to take care of the cheerleaders and everything. So that's my boy with the cheerleaders doing that whole thing. So that was a proud day for him right there, right? So he was quite happy. This is us. We worked with the St. Louis Cardinals too. So whenever the Cardinals won the World Series, I got a little hardware, so that wasn't so bad. So I had to wear that today for being here. But that was an amazing experience. That was one of those experiences that we will always remember. We actually were on the truck, so they do a whole truck parade, right? And so they just go through town, and it's people as deep as you can see, and we're sitting on the truck, and we're sitting actually with Baton Rouge boy right here, Ryan Theriot was, right? So he played for the Cardinals, and he and I hooked up instantly whenever he came up to the Cards, and we got connected right away. And came time, we won the World Series. We're going to go on the truck, and they basically have one truck for all the medical staff, but all the medical staff have all their family too. So players are coming up and asking us, hey, you want to ride with us? You want to ride with us? And that whole thing. So Theriot comes up, hey, you want to ride with me and my family? I'm like, yeah, that'd be great. So we're on the truck and we're riding, and my boy is sitting there waving to everybody. Our middle child, she was the baby at the time, and so we're doing the whole thing, waving to everybody. My son's waving to everybody, and there's just people as deep as you can see, and it's just wave after wave after wave of people, and he's waving to him. He turns to me, he's like, Dad, my arm's getting tired from waving. Can I stop? And I was like, yeah, buddy, go ahead, stop, take a breather, man. Like, don't worry about it. Like, just enjoy this moment. I just wanted him to enjoy the moment. And he's sitting there, and all these people are just screaming and screaming and screaming. And he looks at me, and he looks at all the people, and he looks at me, and he goes, Dad, are all of these people here to see me? I said, yeah, buddy, they're all here to see you, for sure. And he goes, I guess I'll keep waving then, So he kept on waving, right? So we're on the news. So we're on the news in St. Louis. We're on the news locally. We've been on nationally. We've been on internationally. We've done that over 200 times. I just say that just because we love getting the message of health and wellness out to more and more people. That's really what this is that we love sharing the message. In fact, we've traveled internationally. So I've traveled internationally. This is me. I don't know if you can tell, but this is me, and that's my mug on the side of a bus in China. And so I went to China to talk about chiropractic. So I'm a chiropractor, so I went to go talk about chiropractic, about health and wellness and different things we could do. And whenever I went, they said, look, we're gonna go there, you're gonna talk all over. So in 14 days, I spoke in 15 different cities. It was a whirlwind. We went all over. As we're driving, we're leaving a meeting, and I'm looking out the window, and have you ever seen something where you see something, you go, I know what I'm seeing is not actually what I'm seeing right now. There's no way that what I'm seeing, because I'm looking out the window, and I see this bus, and it's got my face on the side of it. And I turn to my translator, and I start hitting her, and I said, what's that? And so she goes to the handler that's in the front passenger seat in the car, and she's asking him in Chinese what's going on over there. And then he turns to the driver, and they're all talking. And then finally she turns to me, and she goes, that's you on a bus. And I go, I know. Why am I on a bus in China? Like, what's that about? Like, you should tell me more information here, right? Like, I need to know more information. And so she goes, oh, well, they all confer and they talk and everything. She goes, okay, so we just wanted to let people know that you were coming to talk about health and wellness, to talk about chiropractic and talk about different things that people could do. It's like, that's amazing. They said, yeah, we just put you on a couple dozen buses. No big deal, right? I was, okay. I said, listen, you've got to do me a favor. You've got to pull this bus over because no one will ever believe that I was ever on the side of a bus in China, right? So the bus pulls over, they jump out, the translator and the handler run onto the bus and they tell the driver what's going on. Hey, our guy in the car is the guy on the side of your bus. Do you mind if he takes a picture really quick? The driver's like, no problem. I've got a minute. Go ahead. So I'm taking this picture here, right? And so I'm standing there, and this is my best attempt at looking as cool and natural standing next to a picture of yourself on a bus that I could possibly do. And I'm awkwardly standing there, and as I'm doing that, getting the picture taken, the driver is now talking to everybody else on the bus. And they're asking what's going on, what are these people doing, all this kind of stuff. He tells them that I'm the guy on the side of the bus. They start coming off the bus to come take their picture with me on the side of the bus. It was crazy, right? So I say all that just to let you know, like, I love getting the message of health and wellness out there to more people, because people need to know. And really our story for this, for what we're getting into for opioids, it actually starts right here in Baton Rouge, Louisiana. So I'm from Baton Rouge, Louisiana. I went to LSU. I met that young lady in the back, right back there, my wife, and she was at LSU. We were studying, and we were both studying to be chiropractors. And so she said, well, hey, I'm going to St. Louis to go study chiropractic. And I followed her like the little puppy that I was, right? I'm just going to follow you on up to St. Louis. And so we went up there, and now we've got the practice going and everything. But in that time, what we're seeing so many people that have been addicted and affected by the opioid crisis. And I know all of us have seen that same thing. That's why you're here now. It's here to learn about more. We've had our own family affected by that. We've had best friends, loved ones, and I know everyone has been in that type of scenario before, where someone that you know, love, care, and trust has been a victim of this opioid epidemic. That we've seen this happening time and time again, and it really has to stop. Like, we've got to take a huge change in what's going on here. And that's what we're going to talk about today. The wheels are already in momentum, like the wheels are already turning to make that happen. And we're going to talk about that too. But these are the 3 key objectives that we're going to make sure that we address. And so we want to make sure that we understand what's going on with the opioid epidemic, with the trends that's happening nationally and locally. So I'll talk about that. We'll also talk about what are the drug companies, like what have the drug companies done and what are they doing now, so that we can understand where that comes from as well. And then we're going to look at, like, how do we combat the opioid epidemic today? Because with all this, if we can have a foundation to build off of and we're all talking the same language, then it's going to make it a lot easier for us to all be on the same page when it talks about, hey, what can we do about this now? Cool? So are we all on the same page with that? Great. So let's look at understanding it locally. And so when we're looking at that locally, this is what we're looking at nationally first, and then we'll come to the local. So the CDC guidelines, it says this. It says that while Americans only represent less than 5% of the total population of the world, we consume over 80% of all the opioids that are out there. So we make up less than 5% of the world's population. We consume greater than 80% of the opioids that are out there. And we consume over 99% of the hydrocodone supply that's out there as well. Just based on that alone, and based on what opioids and hydrocodone and things like that are supposed to do, we should be a nation that not a single one of us ever has any pain ever. Right? Like, are we on the same page with that? Like, that's one of those things where if we're consuming all of it and we make up less than 5% of the world's population, we should be taking it, like, no one should be in pain ever. That's not the case, though. So based on the data that's out there, look, the distributors failed to identify, report, and stop obvious, like blatantly obvious. I'm going to show you how obvious this is. These blatantly obvious suspicious orders that made it to where they're flooding the marketplace for the opioid prescriptions that are out there. The prescription opioids sold in 1999 nearly quadrupled just from that time, right? 2010, 254 million Americans were getting opioids. That's enough for every single adult to be on an opioid every day for at least a month. When we start to look at the numbers like that, we start to see just how bad this is. And I'm going to show you even worse. Even worse is right here. This is Kermit. So this is Kermit, West Virginia. West Virginia is one of the hardest hit states that we've had. They're turning things around. They've done a lot of legislation. They've done a lot of things. In fact, I'll talk about what we're using from West Virginia all over the United States and what we're going to use nationally as well. But this is the town of Kermit. Now, the town of Kermit has 392 people. 392 people. Some of you probably graduated in a class bigger than that from high school, right? From high school. This is actually the picture of their town. That's it. That's Kermit. Now, in 2 years, a company shipped over 9 million opioid pills to that one town of 392. Does that seem a little off? Like, does that seem like, well, there's only 392 people there. How is it that we're shipping 9 million opioid pills to this one little town? Like, that's a blatant disregard for what's going on. That's a blatant disregard. That's one of those things that should be a red flag, right? All of us as responsible adults, not even providers of healthcare, just as a responsible adult, when you see something like that should show somebody, like, there's something going on here, something wrong. And there's a lot going wrong. Basically what they did was they said, look, whenever we're sending out all these pills and we're doing all this stuff and everything, we're using all these opioids, they should be changing things. Like, there should be a benefit. We should have no pain, like I talked about. But what we're seeing is that there's no change in the amount of pain that we're reporting here in America. The amount of pain that we're reporting here in America is still the same. So it would be one thing if we said, yeah, but everybody's out of pain. But they're not. There's no change. So not only is it hurting people, not only is it killing people, not only is it fattening a lot of wallets, but it's also not doing anything good for our country either. So much so that the White House said, hey, this is what we're going to do. They just signed a 600-page bill. This 600-page bill went into effect to say, this is what we need to do. We're going to base this off of what West Virginia has done, and we're going to take a lot of different action steps to ensure that this is something that we change. And some of those action steps are starting to come about now. We're starting to see those things happening now. I did want to mention one thing. We did the quick math on Kermit, right? Yes. And that just popped into my head. So I want to make sure I mention this. We did the quick math on Kermit. For their population of 392, we said with 9 million pills over 2 years, that would mean every single person, man, woman, child, in Kermit, could get 31 pills every single day over 2 years. Right? Like 31 pills over every single day. Doesn't matter if it's a holiday, doesn't matter if it's Sunday, doesn't matter what it is. You're taking 32 pills every single day over 2 years. These things just don't add up. There's problems within this system that we've got to fix and we've got to correct. So the White House has taken action on doing those things. And this is what I'm going to share from you right now. This information is directly from the White House. It's talking about that, look, these drug overdoses, they're now the leading cause of injury death in the United States. Number one, leading cause of injury death in the United States is from these drugs. That 175 Americans die from a drug overdose every day. 132 of them are related to opioids. Just like that. Like when we start to see these numbers, that's every single day that we're seeing that's going on. In fact, if you've been prescribed opioids and you get addicted to them, then you're 40 times more likely to then be addicted to heroin. And if we look at that retrospectively, over the past 12 months, over the past year, if we look at that and we say, the heroin users, 80% of heroin users say, look, I was addicted to opioids first. I just turned to the heroin after that. So I got addicted to the opioid, and then I turned to the heroin to try to substitute what was going on. Either I couldn't get the supply I needed anymore for the opium or the opioid, or it became a financial decision, right? I actually couldn't keep paying for the pills. It was too expensive, so I turned to heroin because they're so closely linked. Now let's look at more locally. Let's look at what we've got locally. So locally, this is from 2012, looking at Louisiana, and then Louisiana prescribes 118 pills, or 118 scripts, for every 100 people. So for every 100 people, we're actually prescribing more than we have for 100 people. We're one of the hardest hit states as well. It's us, all the ones that you can see that are there. Like, we're hit hard with this. But we're making changes, and that's good news. So this graph shows that too. So you can see here in 2012, this is where we were at that. And then when we get to 2017, you can see we're at 89.5. So the number of scripts that we're now putting out is now at 89.5 instead of what we were at before just a few years ago. So we're moving in the right direction. I'm going to tell you right now, I am an eternal optimist. So when I start talking about these things, you're going to see me I don't like talking about the negative side, but we have to address that. I'm going to show you some of the positive things too, because the positive things have to make sure that we talk about that as well, because I want to give credit where credit's due. When people are working and doing their thing, I want to make sure that that's being addressed. Here in 2017, it talks about just that, right? That in Louisiana, now we've got 89.5 opioid scripts for every 100 people. Now in comparison to that, in the U.S., it's 58.7. So we've got 58.7 in comparison with the rest of the United States. We're still at 89.5. So we still have a lot of work to do. We're doing better than we were in 2012, but we still have work to do. Then we start to look, as far as us being in the rates of as far as what we're looking at as far as death goes, that starts to change. So when we're looking at the age-adjusted rate of overdose deaths involving those opioids, unfortunately that has changed in the negative direction. So not following this trend, more than doubling from 1.5 deaths in that 2011 to 3.6 deaths now in 2017. So we're moving in the direction of we're prescribing fewer and fewer pills per 100 people, which is good, but we're seeing more and more deaths that are going on because of these opioids too, because of these prescriptions. And I just want to show you this as well, just so you can kind of have an idea as well. This is from the CDC. This is specifically for Louisiana as far as our numbers go. But you can see how it trends, right? So you can see these right here are the prescription opioids. You can see how we spiked up here in 2007, dipped down, and now we're going back. We're going on the rise back up. And you can see for the synthetic and the heroin and what happens with that as well. I just wanted to make sure that you were able to see those things as far as like what's going on locally right here in our state and what's happening and what do those trends look like whenever we're looking nationally too. Unfortunately, the bad thing is with all this stuff is not only does it make it to where now we become addicted as adults, but now we're seeing more and more of this going on, right? Which is heartbreaking. Heartbreaking. If you think about it, back in the 80s, late 70s and 80s, we had crack babies, right? Like we're all old enough to remember like that time whenever we had that. Unfortunately, to no fault of their own, they were born into that situation. Now these babies are having this exact same thing. They're addicted to opioids because of their mother being addicted to the opioids as well. So every 25 minutes, a baby is born that's now addicted, that's going through opioid withdrawal. And so that's going to account for $1.5 billion in healthcare charges every year, just from that. So the financial ramifications of this on us, not just the healthcare system, but us as people in the community is staggering as well. So again, we've got to make a lot of changes within this. But there is a glimmer of hope. And so, I hate to say that this is a glimmer of hope whenever I talk about the ages of these kids and talk about their grades, and you can see that up there. But it is. I'm going to take the wins where we can take them at this point, and let's take those where they are. Because we're seeing that there's a reduction in the misuse and abuse that's going on for kids as far as Vicodin goes. And so it's a decrease, 51% in 8th graders. I can't even believe that I'm saying that, but 51% decrease in 8th graders as far as taking things like Vicodin. 67% in 10th graders, and then we're seeing 74% of 12th graders. We're seeing that change, that decline that's happened between 2010 to 2017. I'll take those wins. If we can have it to where these kids are not getting addicted as young, because it's happening more and more, then that's a good thing. So they're also seeing this, that 35% of surveyed 12th graders, that they notice that, look, it's really easily available whenever we're looking at it, but compared to where it was before, it's less available as far as what it is that we can get. So you've heard kids that have said, like, it's easier for me to get this than this, right? It's easier for me to get a hold of my mom's opioid prescription or a Vicodin or hydrocodone or whatever it is than it is for me to get a hold of alcohol. So I'm just going to get that instead. And now what they're seeing is it's not as easy for them to get a hold of that, which is good. Like, we need more of that. Now let's look at these drug companies. Let's look at what's going on with them, because I want to make sure that we get into that as well, because these drug companies, y'all, like what they're doing is, it's just bad. It's just, it's heartbreaking. So Pfizer's not even a big one in this space. They're not even a big one, but I wanted to show you even the small guys, what they're doing. So even the smaller companies, this is it. They're saying, look, what they're doing is they might not sell as many, but their marketing efforts, it sets them apart because they're just aggressively marketing these drugs so that they can get more profits. That's what all this stuff comes down to. All this comes down to, let me get more profits. In fact, this one right here, these guys are the worst. The worst. And we're going to talk about these guys a little bit more, but this is Purdue. So Purdue's the one that came up with Oxycontin. Now, when Oxycontin originally came about, it came about for cancer. And look, let's face it, if you've ever seen somebody that's in terminal cancer or dealing with the amount of pain that they deal with cancer, like all you want to do, all your heart wants to do is take that pain away. And this is a great place for that because of the fact that it can like these opioids, they take away the pain. And when you've got somebody that's terminal, they're going to be passing away anyway. They're going to be transitioning. Let's make it to where it's as least painful as possible for them if that's what they so choose. And that's what they're looking at. So what ended up happening is that these companies said, you know what, we've got a much larger market out there. And we have a larger market out there because of the fact that we've got all these other people that are in pain. So instead of just taking care of the people that have cancer, let's use it for everything. Let's use it for low back pain. Let's use it for knee pain. Let's use it for headaches. Let's use it for whenever somebody has a sports injury. Let's use it for whenever somebody has dental work done. Let's use it for fibromyalgia. Let's use it, like anything that you can have that's out there for pain, let's go ahead and do that. Let's just open that wide. And this is what they did, right? These public health experts, they looked at it and they said, hey, what's really going on within this? And they said, look, these opioid companies, they're exaggerating the benefits of what's going on, and then they're downplaying everything as far as the safety goes within that. They're getting these they're supporting advocacy groups, which I'm going to talk to you about here as well, to educate people, to educate the public on what's going on with these opioids and how safe they actually are. And we'll talk about how that's completely wrong. To encourage the widespread use of those opioids. And that was then, of course, supported by lobbyists and lawmakers to make sure that, hey, this stuff gets passed through. In fact, we were talking about this with this group right here, OxyContin. The president, I'll talk to you about him in just a minute. The president of Purdue, the former president now, his name's Sackler, and so it's the Sackler family that owns Purdue. He said, with pride in his heart, he said, we were able to get OxyContin through the FDA for these things: low back pain, knee pain, headaches, all of that, fibromyalgia, all the things you have listed, any type of pain that's out there. We were able to get that through in such speed that we used to rate that in years. I'm proud to say that we were able to do it in 11 months. So they were able to fast track it through. Fast track it through used to be it might go through in a couple years. Now, for them, in this particular case, 11 months it got through on. You tell me, you think that they were able to do everything they needed to do to ensure the safety of all of us and our loved ones and our family in 11 months? Or do you think that there might have been something else that was going on within that black hole that's going on there, right? I mean, that goes deep within that. We don't have time to get into what goes on with that. But I will tell you, I find it disgusting that the guy said, look, we did it in 11 months. When normally we would rate that in years and be proud of it, we did it in 11 months, and he's proud to say that. So that means he can get to his customers that much faster. And what they did was this. So you have to be thinking to yourself, how is it that anybody could then look at that and go, how is it that they're able to get that through the FDA? Like, what is it that there has to be research. There has to be things that we're using. There has to be studies. And so these drug companies are really smart, y'all. Like, very, very smart. So what did they do? They took a study. It's not even a study, by the way. They took a study that they took about 40,000 people that they had used opioids in some way within a hospital setting, and then they tracked them. And then after using that, then they said, hey, are you still addicted? Let's find out if this person's still addicted. And they found only a few people were addicted. So this means that this is safe. Yeah, logical thinking, right? It's safe. We're good. We did this study. Now, what they did was they had this published in a very prestigious peer-reviewed journal. And within that peer-reviewed journal, they then from there forth referred to this study that was published in that peer-reviewed journal. Now, here's the sneaky thing that drug company did. What they ended up doing is, this was just a letter to the editor. This is not an action. This is just literally, this is to the editor. It's just a letter that they put to the editor. It's like the thing that you find in the very back of a journal or a magazine or anything else. It's just an anecdote. It's not even something that you would ever even mention. It's just a letter to the editor. But what they did was they got it into the peer-reviewed journal. They got it into the journals. And when they got it into there, then from there forward, they always referred back to it as the study that was published in that journal. But nobody could ever find it. And then finally, they ended up figuring out this is where it's coming from, a letter to the editor. Like, that's sneaky, right? Like, that is sneaky whenever you look at that. But then it opened it up. It opened it up for everybody. Now everybody can use this. Because, look, the advertising that they started having out for everything, all related to you don't have time for pain. And you shouldn't be in pain. And I agree with that. Like, you shouldn't be in pain. But we got to get to the cause of what's going on. Because taking these pills is not fixing the cause of what's going on. So they started putting out posters everywhere. And they were doing this. They were lying to all the providers too. They were lying to them using the same studies, using the same sneaky tactics that they used to get the stuff that was published. They used the same sneaky tactics to then go to their providers and say, hey, you should prescribe this. You prescribe this. This is great for knee pain and shoulder pain. And here, look, this is great for IBS. You have pain anywhere? This is the pill you want to take, right? These are the pills you want to take, no matter where it is. You got hip pain, IBS, back pain, shoulder pain, nausea. You got migraines. No matter what it is, take this pill. Sounds like the magic pill, right? Like, obviously, it must be, because they were pushing everybody to prescribe that. But this is what we saw. We saw that they did another sneaky tactic. that they made the people that got addicted to this, which they knew was addictive. They knew. They absolutely, without a doubt, knew how addictive. And I mean the companies knew. I do not mean the providers knew. By no way, shape, or form would they know. It's the companies that knew this. They knew just how addictive it was. And what they did was they said, listen, anybody gets addicted to this, it's their fault. It's on them. So they turned it around and they said, look, these addicts, if they're taking these opioids, it's because they have unbearable emotional problems. Unbearable emotional problems. So you tell me, if somebody says, hey, I'm going to give you this pain pill, it's going to take away all your pain that you have for your IBS or your knee pain or your neck pain or your back pain or your nausea or fill in the blank, whatever it is. You don't have unbearable psychological problems, do you? Because this is the way the patients are seeing it. I don't mean it as in like the doctors are saying it, but that's the way the patients read this. The patients read this as, I don't fall into this category. I don't have unbearable emotional problems. So for me, it's safe for me to take this. Again, the public's being lied to. We as providers are being lied to within that as well. So we want to look, we want to find, like, where can I go to find more information about these things, about these opioids? How can I find out more information about this so that I'm educated? Because we all want to be educated within that as well. And so they started distributing. Remember how I talked about in the beginning? I said they would then support all these different groups, right? So the companies, the drug companies, the manufacturers, and the distributors would support all these different groups. And this is what they did. This is the American Pain Foundation. The American Pain Foundation, they said, look, we're dedicated to eliminating the undertreatment of pain in America. The undertreatment. So again, positioned as, it's not your fault that you're in pain. You've been undertreated. And we need to put pressure on the providers so that they will then treat you. Sneaky, right? Like, for them to do that again, very, very. I don't know if you can read this, but I'll read just a couple of them for you because I know that it probably doesn't come out, it doesn't translate as good on this small of a screen. But this is it. It says, here's the organizations that are represented by those who helped create this publication. And it just gives a list of all these people. And so it gives a list of all these societies. American Academy of Pain Management, American Academy of Pain Medicine, American Alliance of Cancer Pain Initiatives, American Pain Society, American Society for Pain Management, you get it. Association of Oncology Social Work, right? Healing Touch Interventional. Like, you get the idea. They just stacked all this list of people. Now, if we were in the public and we're looking at this, the public's initial thought on this is, holy cow, you got all these groups of people to get together to determine whether or not this stuff is safe for me and how effective it is and how good it's going to be for me. Like, they're stacking the deck. Like, they're leveraging it to the hill. And then what they did was, again, man, these guys, I know I've said it a million times, but it's true. Like, the marketing that they put forth to just dupe us is just tremendous. They said, here, look, these are the pharmaceutical companies that contributed to this. And this is the way they worded it. It was very, very, oh my gosh, very, very. They said, we want to thank them for their generous support of unrestricted education grants. Now, if I'm in the public and I read this is an unrestricted education grant, I'm thinking that's a good thing. It's unrestricted. So if it's unrestricted, then that means that they can do whatever it is that they need to do, and they're just going to speak the truth, because obviously we have all these organizations. Now, all those organizations that we listed before, all those organizations are ones that are funded by the pharmaceutical companies. And then you've got the pharmaceutical company that then funds this whole project. When you start looking at all that stuff, like, of course it's going to point in the direction of more drugs, right? Of course it's going to end up these kind of things. Of course it's going to where they're going to look at it. Hey, look, in 2 years, this is another one, McKesson, they shipped 5 million pain pills to a town of 400. Like 5 million pain pills. Again, that's not just what we saw that was going on in West Virginia. This is happening all over. This is happening here in Louisiana. This is happening everywhere. They find these small towns or big towns, whatever it is, and they just pump a whole bunch of pain pills into it so that they can get people hooked. Now, these people here, they take the prize. These people are called the Sackler family. And the Sacklers, they're the ones that I mentioned that own Purdue. And they're the ones that are under an incredible amount of scrutiny, and rightfully so. Because the Sacklers, what they did was they did this. They said, look, they took internal Purdue documents and they put those together that said that OxyContin was now going to be, it was developed as the cure for their financial problems. But the problem was this, is that the OxyContin was seen as something that they were only going to use for cancer patients. And the problem is that their time was running out with it, right? So they were starting to see that, look, our patent on this is running out. And since our patent's running out, we're going to lose financially, like greatly. We're going to lose a ton of money. We can't let this happen. So what we need to do is we need to open this up to everyone else that has any kind of pain. They're the ones that helped lead the charge with that. Again, they're the ones that said, we got this stuff pushed through in 11 months, and we're proud of it. So what they ended up doing was they ended up seeing the profits of it. This is the thing I want you to see right here, just this bottom right here. That Forbes, they basically said, this family who owns 100% of Purdue, this family that owns 100% of it is now worth $14 billion, which puts them right up there with the Rockefellers. All from our families, our friends, people in our community being addicted to this stuff. So here's my thing. I like to look at it as, but if they're doing that, it's helping people, they should get compensated for it. If it's helping people, they should get compensated for it. The problem is that, again, there was no material health care benefits within any of that, and no overall change in pain in the United States at all. So nothing changed. All it did was it made more addicts. All it did was deepen their pockets. It made them rich because they ended up having more and more people on there. So now you're going to start seeing more and more of this. You're going to start seeing more of these that are going to happen where they're going to do these opioid lawsuits. And this person, Richard Sackler, I use the word person kind of loosely, and that's kind of my jab at him because he's Sackler, so what? But you get the idea. Like, he's the former president of Purdue. And this is what he said about people that are taking his drugs for his families. He said, we have to hammer the abusers in every way possible. They are the culprits and the problem. They are reckless criminals. He said that about people that were addicted to the product that he's selling. This is what you and I were talking about. This came out yesterday. Criminal charges. This is the first major drug distribution company that the executives are now being charged in an opioid suit that they could face up to life in prison. It's coming, right? It's coming. There's more and more of that coming that needs to happen. They basically they willfully neglected the finding of its own compliance company. So their compliance companies would say things like, hey, you're sending 9 million pills to a town of 392 in a 2-year span. There's something wrong here. And they go, yep, great. We're going to neglect that. We're not even going to look at that anymore. Hey, you're sending pills to a town of 400 people, and in a few years, you're sending 5 million pills to them. Hey, don't worry about that. All because they wanted to put profits over people, right? So here's the thing. They made a ton of money in that. From 2012 to 2016, the company sold of just their pain pills went from $4.7 million to $42 million. That's from 2012 to 2016. So in 4 years, it was nearly a 9-fold increase that was there. Again, these are all glaring. Remember when I told you, I said, look, you're going to see that these are things that are just glaringly obvious. This isn't something that you just, oh my gosh, I wonder how all of a sudden my paycheck was 9 times greater. I wonder what happened there, right? Like, you're going to wonder. You're going to ask some questions. These people, they didn't. They just said, you know what? It's fine. Let's just keep doing it. And so now it's time for them to pay the piper on that. Because the things that they're doing, we're seeing more and more states that are getting involved in suing these companies. And that's what we were talking about too, is that these states are doing that, and it's happening. And it's going to start to tip the scales. And then this next part, this is where it comes to us. This is where it comes to the things that we can do, right? That we've got to combat the opioid epidemic today, and this is what we can do. I'm a big proponent of working together. Like, that's what we have to do. But let's figure out, like, some of the things that we need to be looking for. Because when we're looking for it, like, we need to identify the misuse and abuse of these medications. Like, we need to figure out what's going on with that. And these are just some of the things that you can look at, but some of the main ones. The symptoms would be things like increased sensitivity to pain, right? Nausea, vomiting, dry mouth, constipation. Those are some of the big ones that whenever someone's constantly complaining about those things, we need to be saying, why are you constantly asking for constipation medication? Why are you constantly telling me that your dry mouth is always a problem? Like, we need to be looking at that as well and trying to find out, because we know that what ends up happening for us as providers, as healthcare providers, what ends up happening is they go to this person for this, and then they go to this person for that, and they go to this person for that, because they're addicted and they need to get what they need to get, but they're doing whatever they can to get it. And it's up to us to, unfortunately, to look at those things. I shouldn't say unfortunately, I should say fortunately, because if we're educated and we know what to do, then we can do our thing and we can make sure that we don't have more and more people in this situation. So Lakeview said this. They said, these are things that you need to look at as far as what happens in an addiction cycle. So people that get in these addiction cycles and they're trying to get out of it and they're trying to make changes and they're trying to make things happen, we're going to see mood swings. We're going to see these defense mechanisms. That's a fun word to say really quick, right? So defense mechanisms that they put up to protect themselves emotionally, because what's happening is they're now becoming unreliable. They're being dishonest with their family and friends and people that they trust and love. They're isolating and withholding from themselves from loved ones. They're just pulling back and they're starting to, like you've seen those people that like they just started detaching and they started pulling away from us, right? And you feel like you're losing them. That difficulty with those interpersonal relationships, that they just can't have relationships like they used to have because there's so many things going on within this addiction cycle. When we can see those things going on, we need to act. And we need to know, like anybody that's dealing with this is things that we need to make sure that we're addressing. So I'm saying all that, and then now I'm going to look at it from how can we do this as a team approach? And what is it that we can do within that as well? And I want to make sure that everybody understands this too, that when we're looking at this as far as addiction goes, that the numbers are out with the fact that 26% of people on their first script, they become addicted. 26% on their first script of these opioids, they become addicted. That's over a 1 in 4 chance of being addicted for my elbow pain, or for my knee pain, or for my hip pain, or for my IBS, or for my headaches, or whatever it is. And when you start to think about that, and we start to think about, we know that patients come to us and ask for specific things, right? Because they're marketed to. And they're marketed to that it's safe, and that it's okay, and we can trust this. But whenever we start to throw these kind of numbers at them, like, hey, did you realize that it's a 26% chance that from this script right here, you can get addicted? They're like, wait, hold on, what do you mean addicted? Right? Like, it starts to change the whole paradigm. Well, what are other things I can do? And we'll talk about that, other things we can do. In fact, in this coalition, right, so the Coalition for Safe and Effective Pain Management, what they did is they started retrospectively looking at and auditing. They started going back and looking at all these different patient groups and subsets within that and trying to figure out how do we figure out what's going on here and how do we lock this in and have real numbers. Because remember, what they were using before was, look, we looked at 40,000 people, 39,900, whatever. We looked at all these people. None of them were addicts. There was only a couple of them. It was really safe. But now when we start to see these numbers and we start to go, hey, look, from your first script, 26% chance of being addicted, that's a problem, a big problem. And we start to see this too, like the demand of opioids is often based on the fact that it can fix things like chronic or even acute pain. And because of that, people have this misconception and they come to ask us for what they can get and what they can do. We need to realize that we need to steer them in a different direction, because that comes with huge risks when we consider that 26%. So coming back now to the White House said we should all do these standards of what it is that we should be doing. And really what that is it's each one of us working as a team. That's it. It's each one of us doing our part to understand how we can connect and how we can work together. So this is me on the field with some of the other healthcare providers for the Cardinals. So they did a whole ceremony, right? So they did a whole thing and everything like that. But the cool thing is that whenever you're working with a team like that and an organization like that, that the ego side is not there. The main thing is get the player healthy or get them back on the field or keep them on the field. Like, what is it we can do? So if I'm the chiropractor and you're the orthopedic surgeon and you're the MD that is there for the general and you're the one that's the PT and you're the one that's the athletic trainer, and all of us sit together and we look at this player and we each go, from my perspective, this is what I'm seeing. And each one of us can address that, then we're working in a team environment and we're allowing that patient, that player, to get the best results possible. And that's what we all can learn from within this. That if we can have our healthcare team and not know like, hey, I'm the one that's going to take care of all of this. That's not the case. Like if I can do what I'm best at and you can do what you're best at and we can all do our thing. And that means the patient wins. That's the way real life should work. isn't it? Like whenever you have your loved ones that are sick and ill, you want to have it like, oh, well, she's the best at this, he's the best at that, she's the best at this. Everybody has their thing they're great at. And because of that, if we can all work in that type of space, then the patient wins and our communities win and families win. Because we've got to start changing things. So this is it, right? It's preventing those opioid misuse through those non-pharmacologic therapies. And this is what they are. It's everything, and there's more to it. This is just some of what the White House bill recommended. Remember, that White House bill was based off of what they did in North Carolina. This is more from the perspective of when somebody comes in and they're having this problem, they're having this pain, this problem, this issue, then what is it that we can do, right? What is it that we can do to help them? And what direction can we take? And I'm going to show you something here in a minute.
You said North Carolina.
I'm sorry, thank you. West Virginia, sorry. Thank you. West Virginia. So, but it's physical therapy, chiropractic, acupuncture, massage, exercise, stretching. Like there's a whole slew of things, and it's all based on what West Virginia said. So, all right. So, thank you. 25% of all opioid prescriptions are given for back pain. That's a quarter of all of them. If we just got that off the table, that would be a huge win. Just that alone. But as you'll see here in a moment, like our ideas of what we can do for back pain, it's all over the map. And I'll show you what I mean there. Literally, it's all over the map. But whenever we look at these systematic reviews for back pain, it's really limited as far as what it is that the opioids do as far as efficacy for taking care of that. So it doesn't fix the problem. In fact, it becomes more and more of a problem. So these organizations, they all said, look, what we need to do is we need to take non-pharmacologic approach before we ever consider anything else. And that's coming from, the Institute of Medicine, the FDA, the CDC. Also, Harvard was looking at it too. So Harvard is looking into this. And I love this because I'm a chiropractor, right? So hi, I'm Dr. Vidan. I'm a chiropractor, right? So this is what Harvard was saying. Harvard is putting this information out there too. They're saying, look, Harvard Medical School said that if you're ever wondering where to go whenever you have low back pain, look to the chiropractor. Like, look to them for this because the research supports it. They put in there as well in that Harvard Health, they said, look, chiropractors can be a great place for, let's say, back pain and help people with things like sprains, strains, herniation, slip disc, all of that. And that's coming from Harvard. They also said, and this was my favorite part right here, they said, chiropractors use posture exercises, they use hands-on spinal adjustments to relieve back pain, improve function, and help the body heal itself. As a chiropractor, like that's what I want. I want your body to do what it's meant to do, which is heal itself. And that's really the basis and the foundation of what we do as chiropractors. It's like we just want the body to heal itself. Because instead what we're doing a lot of times is we're saying, well, let me take this pill to mask the pain, right? So if I'm using the example of if you're driving in your car and your car, the engine starts rattling. It starts making all kinds of crazy noises. All these crazy noises. You tell me, is it a good idea to then go, I'm just going to get earplugs and put those in so I cannot hear the noise? Or is it a better idea to take it to the shop to have somebody actually fix and correct the problem? Right? So the earplugs, you get it, like you laughed and you smile, right? The earplugs is the pill. It's the opioid. It's just there to cover it up. It's there to just plug it so that you can't feel it because what it does is it suppresses all your neuroreceptors and everything else so that you can't feel it. It doesn't mean the problem's not there, right? It's not going to fix the problem. If there's a structural issue that's there, we've got to address the structural issue, and that's what we need to be looking at. But I wanted to give you because I'm saying these things from my perspective, and so I wanted to give you something that looks at it from the perspective of this is UHC, so United Healthcare. And this is what they presented at, and they were talking about, these are some different ways that we need to look. So what they're going to look at is, of course, they're going to look at their bottom line. Look, they're a company. They're going to look at their bottom line. They want to know, how is it that we can best serve our customer, our patients, how can they best serve them to get the best results possible and make sure that we don't pour more into this opioid epidemic, because this is what we're finding. So they actually use actuaries, people that just sit there and just do numbers all the time, right? They just crunch numbers to try to figure out, and this is what they came up with. This is it's 5 minutes. I'm going to cut it short, but just so you know.
Good afternoon. Like Catherine, we're going to use back pain to talk about what it is we are doing, not thinking about doing. Here's some data to establish context. If we look at back pain, Non-surgical back pain, 30% start with PCP, 40% specialist, 31% chiro, PT, acu, OT. Total episode costs are to the right. The way to interpret that, blue is how much we spend with the first provider seen. So PCP, blue is how much did we spend with the PCP. Green is how much do we spend with other providers that practice with the first provider. And where this gets interesting is orange. When the patient leaves the first provider to go into the delivery system and get other services from other providers for the same episode of the same condition, what do we spend and who's seen? And the orange is where we see chiro and PT and acu stand out, meaning we make the investment in blue with chiro PT, the orange piece of the bar collapses pretty significantly from the other options. So that's where the total episode savings is occurring. And the dollars with the prevalence of back pain is real. And we'll talk about that in a moment. Below are the attributes of the episode, starting with these pathways. Number of different providers seen, fragmentation. How likely are you to receive recommended therapies? How likely are you to receive therapies the guidelines suggest you shouldn't be receiving? How likely are you to receive imaging and at what time in the episode? And in green, the pathway that's most aligned with all prevailing guidelines are when patients start with chiro, PT, acupuncture. Least fragmented, you receive the services you should, you avoid those that you shouldn't, imaging is aligned, total episode cost is lowest. That's attractive, yet only 30% of patients are starting with the ideal pathway. So what are we doing, like actually doing? And this is sort of our roadmap. And so if we start on the left, patient with back pain consults a variety of sources of information to decide what to do. They go down one of these three pathways, primary care, specialist, or conservative. There's the 30, 40, 30% front door. Our ambition, our goal is in 2 years is to take the front door access to conservative care from 30% north of 50%, and then timely referrals from those that self-select a medical path to take that from 2% north of 10%. And collectively, the actuaries have done the work. It's presented at the actuarial conference that net of the increased conservative costs on our commercial book, this will take out about $230 million in annual medical expenditures and reduce opiate prescribing for back pain by 25 to 26%.
Do you hear that? He's going to reduce it by 25, 26%. Remember when I showed you that statistic that was, look, 25 to 26% of opioids are prescribed for low back pain. And so he's looking at all these different portal of entries to figure out, like, all right, where can we send them? Like, where is the best place to go? I just want you to see this one thing here.
So our ambition is leveraging two parts of this journey, the front door and then the side door, referrals to conservative care. And what are we doing? In A, start with, it's come up multiple times, file 2019 and 2020 benefit plan designs to include waiving out-of-pocket costs, whether they be copays or deductibles for consumers that access conservative care options for back pain.
Do you hear that part too? Like, they're looking at it as, we're going to save so much more money, we're going to waive them going to see by going to the conservative route. Like, we're going to waive the copays, we're going to waive the deductible. Like, we're doing that because we know that we're going to save so much more money. That's absurd, right? Like, that's crazy. That's huge to look at it and say, they're going to waive all that because they see actually the cost benefit. Even if everybody, if it goes from 30% up to 50%, which is what he was talking about, if that changes, it's still more cost effective for them to go ahead and just waive that so that people get that care and that they actually don't end up on the back end of the system.
Plans are filed, extraordinarily complex to make that work at the scale that we operate, but a lot of calories are being burnt to make that a possibility in 2019, 2020. Surrounding that, whether it's print, digital, portal, telephonic, a variety of almost public service communication efforts to help patients and employers become better consumers of care for spine-related disorders. Another key point, we're at yellow, we're not going to get through all this, it's kind of ambitious, but at B, at this point where patients are deciding, okay, I'm going to go into the delivery system, provide tools and resources that are simple to understand what's wrong with me. Do I have a red flag which I should escalate immediately? If not a red flag, what are my options? Present preferences and range of options for your preferences. Based on those preferences, who are the providers? Zip code, miles, minutes, gender, language capability, specialty, episode cost, that are sort of in your sort of set of preferences. Rack and stack those providers based on performance. We're connecting to practice management systems of these providers to see appointment availability in real time through their scheduling API layer to allow the patient to push a button, schedule with a provider that they choose to see, and ideally that'll be, in many cases, these conservative providers. So the point here is, I have no out-of-pocket cost. Here's the providers available to me that meet my preferences. Here's who has an appointment this afternoon or tomorrow. Push a button, done. And then for the medical paths, primary care and specialists port that same kind of technology into their workflows by embedding into Epic and Cerner, so that the medical physician can know, no out-of-pocket, here's the PTs and chiros in the community, here's who's open this afternoon, push a button, refer, and connect the dots. So again, our ambition is really to drive up access to these conservative therapies by almost doubling the current rate. And I do have an appendix. I'll leave you with a picture. This is the current state of spine care today.
I'm just going to quickly tell you about this, right? Because this is what he's saying is this is the current state of what's going on for a low back pain. That based on the specialist, this is what the trend is. Well, there's no trend there, right? It's if you go see this person, you're going to do this. If you go see this person, that's going to happen. If you go to this one, it's all over the map. And so they're looking at it as we need to narrow that because pretty much everything else has like a trend, like an escalation of, all right, first you go here and then you go there and then you go here. And they're trying to figure out, because we already have guidelines in place for these things. So if we can follow those guidelines and do what they're asking here and looking at here and not do this where we're all over the place, it's no wonder that people, whenever they have things like back pain, go, I've tried everything and nothing's worked. And so, yeah, let me do this. Let me take this opioid. Let me do whatever it is, right? They get stuck into this pattern of pain and they just want to get out of it. And there should be a set process, and that's what he's talking about here. Now, for me as a chiropractor, right, I'm going to look at it from the fact that, look, chiropractic patients use 55% less opioids than non-chiropractic recipients. So if we can get that down like that, then that's a good thing. And so people are asking me, and so I want to make sure that when we're looking at this, as us as providers, I want you to know, like, what are things that you can look for in finding a chiropractor in your area? And you can use these same strategies for who is it that I'm going to find for a PT? Who am I going to find for an acupuncturist? Who am I going to find for a massage therapist? Like, we need to have our team that's together for that so that we know this person comes out and we're going to do that. This is what, if I'm looking and somebody's asking me, they're like, hey, I want to find a great chiropractor. What do I need to look for? Well, these are the things that I'm going to recommend. These are the things that I'm going to, because of the fact that I travel everywhere and I speak, people are always asking me, they're saying, hey, I want to find a chiropractor. I want to make sure I get taken care of. What do I need to look for? I'm going to give you a couple things to look for, just to kind of have that in your back pocket whenever you're thinking about it. Examination, like that seems easy enough, but I want to make sure that they're doing a thorough examination of exactly what's going on and finding out, like, do we need to do ortho neuro tests? Like, what's going on to find out how we can best help this patient? X-rays, do they need to have X-rays? Like, a lot of times, like, we do X-rays because I want to know what's going on inside their spine. I don't want to speculate. I don't want to guess. I don't guess with my family. I'm going to say, I'm not going to guess with your family either. So I'd want to have another chiropractor that's looking at it from that perspective and saying, well, we're not going to guess. We're going to know exactly what's going on. So if that's the area of complaint, let's check that out. Let's do some X-rays and let's see what's happening. I don't want to find out that all of a sudden there's something there that isn't the thing that I'm best capable of taking care of, right? That might show something else on the X-ray that I go, hey, I need to send them out to somebody else. I'm not the best place to help you. You need to go here instead. So review the results. I find that it's pretty important to make sure that we're reviewing what it is that we found so that we can understand exactly what's going on so that the patient understands why it's important for me to follow through on this stuff and for me to do it. Provide a specific course of care. They need to have a specific course of care of what's going to happen, not just a let's wait and see. That's okay if we have a very specific outlier case, but for the vast majority it needs to be, all right, this is what we need to do to get this corrected based on our findings that we found on our examination and x-rays if that was necessary as well. So we're going to look at those things, and these things seem simple enough, but whenever you're kind of looking, these are questions to ask. When you're asking these chiropractors to find out, like, what is it what do you do? Do you do this? Do you do that? Do you do this? Do you do that? It lets them know, like, oh, okay, you're looking for these specific things. We don't do that, or yes, we're exactly the office that you need to see for that. We can help with that, right? And then co-managed care. Look, I'm open, and I'm always open because of our experiences in the past. I'm always open to co-managing care. I love co-managing care because I find that it gives an opportunity for us to open up dialogue. And again, that's where I find the patient gets the best results possible. If we're all closed off and we're all at a point to where it's like, well, I'm never going to talk to you about what's going on. I'm never going to talk to you about what's going on. Then if the patient needs that, then that's what we need to make sure that we're doing. And they need to, that chiropractor that you're finding needs to be open to that too. Now, people ask me about techniques. So earlier they were asking me about different techniques, right? They were saying, well, what about these? There's so many different techniques. None of them are better than the other ones, I'll just tell you. Now, I know this is being recorded, and some of my chiropractic friends are going to be like, what do you mean none of them is better than the other? My technique is the best. I get it. I know. Here's the thing. All techniques are great. It's just whether or not it's great for that person at that time. And that's the truth, right? Like, all techniques work. All techniques do their job. Otherwise, they wouldn't be a technique. It's just the way I like to get adjusted might not be the way that you like to get adjusted, right? It might not be the thing that works best for your body, but it's the thing that works best for my body, right? Like, that's simple enough. Just like for you, right? We've got care whenever someone is saying like, hey, I'm addicted and I need to get off of this. I've got care process that happens with, there's different things that you're going to do. This is our philosophy here, and so we're going to do this. And whereas somebody else is going to say, well, our philosophy isn't the same as that. Ours is this for addiction care or for whatever it is. You get the idea, right? So they all work. It's just whether or not one works for you and for that particular patient at that time. So again, my big thing that I'm really going to hammer home is the team approach. Is really like, if we can open, for me, I see this, like this, anytime that there's huge obstacles, there are major opportunities. Major opportunities. And this opioid epidemic is a major obstacle for all of us, for all of our families, for all of our communities. And what I mean by the fact that there's a major opportunity is that there's a major opportunities for us to all open up the dialogue with each other so that we all get an opportunity to find out how is it that you can best help them? How is it that you're going to best do that? Like, what is it that we can do to all work together? And within that opportunity means that we're going to have more successful, more healthy communities and families that we can all take care of for decades and years because of the fact that they're not going down the spiral of addiction within the opioid crisis. People were asking me about my contact information, so that's it. That is a picture of my wife and I 15 years ago, right? Today, 15 years ago today. So I had to put that in there, right? So that is my contact information. That's us. I don't say this as in like, hey, you know, like this is literally, if you have questions, let me know. I'm here to help. I don't want it to be just something that, oh yeah, remember that chiropractor that came, he came on his anniversary. Can you believe he came on his anniversary? Oh my gosh, right? Like that kind of a thing. I want it to be, what else can I do to help? Like, what other value can I help add to that conversation? What else can I do to help within that? And I might not have the answer, but I might know somebody else that does. And if you reach out to me, I promise I'm going to connect with you. I'm going to make sure that any questions that you have, that we figure them out together to get answered. But thank y'all so much for having me. I truly appreciate it. Thank y'all for having me. I appreciate it. Thank you very much.